Well, it's not pretty. We did a lot of work on this. We had a huge interest in this inquiry, roundtables, a huge amount of evidence that came into us. We found people who couldn't get access, couldn't afford private treatment, pulling teeth out themselves, 5 hour round trip with children. We heard 4.5-year-old who hadn't seen a dentist since he was a baby. Despite I think his parents said they tried 10 practices to try and get NHS treatment. And, yeah, obviously there is the issue that has with their dental care, but just the wider oral health and getting children used to being in the dentist chair, which, let's face it, none of us like. I can't even bear to see the pictures that you're running of people's teeth in the dentist chair. But when you're very young, it's very important to get children used to being in the dentist chair. And we've heard some pretty worrying stories, and that's why I say in the report it is totally unacceptable that in this day and age we are still in this situation.
Well, yes, and so how bad is the crisis of access? How would you describe that, the scale of the crisis?
I'd say the crisis is at a sort of 3 out of 10. I think rarely has there been an inquiry where I've had such universal approval from committee and from just people across the House, actually. There's a crisis of access to NHS dentists. And what I would say is, so in many areas, so when it comes to the primary care plan, the choice agenda around beating down the waiting list, the workforce plan that was produced. There are many good positive signs that this Prime Minister, Chancellor and Health Secretary are putting in place that will, I think, bear fruit. When it comes to NHS dentistry, not so much. And fundamentally, it comes down to the government's ambition in this, and we asked the dentistry minister, Neil O'Brien, when he was before us, what is the actual ambition? Are you saying that it's no longer the case that we are just going to be able to have NHS dentistry available to all? And he said, no. Our ambition is that everybody who wants one should have access to an NHS dentist. Okay, fine. Happy with that. We say in the report that we were pleased and surprised to hear that ambition, because right now we are a long, long way from it. And to hear people in such pain and distress that they're pulling out their teeth is a huge worry. And the problem's then compounded by the fact that I think there's very little information about what people are entitled to when it comes to NHS dentistry. And I think on our part, we're incredibly frustrated that our predecessor committee 15 years ago made very clear recommendations in this area, and they still haven't been followed up. So this spans, the last government, it spans the coalition government, and it spans my own government.
So what has to be done to achieve that aim?
Well, first of all, keep tinkering around the edges. And to give the government credit, they have made changes to the dental contract. And that's both good and bad. And the British Dental Association would say that, yeah, okay, but we can't. We're moving the deck chairs around on the Titanic with contract reform. The contract needs completely replacing. And without getting too technical at breakfast time, what happens at the moment is dentists are paid around units of dental activity as opposed to holistic care. And that's one of the reasons why dentists are leaving the profession. So we need a completely changed contract. But my concern, my sort of half empty view, if you like, is that, and this happened to me recently, so many dentists are leaving doing NHS work because they don't feel they can offer that holistic, preventative oral healthcare to their patients, that even if the contract were changed this morning to what they want, they've made a mental leap, which hasn't been easy for a lot of them because they trained to go into NHS practice, that it's going to be very hard to get them back. So we say in the report that as well as fundamental contract change, there needs to be a big return to NHS dentistry campaign, as we've seen return to nursing campaigns, so that people come back and work in the profession, because right now it's on the brink. This is a very complex report. There's a lot of detail in there. It's very, very well evidenced, I think. But when the British Dental Association said that this is an instruction manual to save NHS dentistry, it's very kind of them to say. I hope that this government and the next government of whatever colour picks that up and makes it happen.
OK, very quickly, I just want to ask you about our latest Westminster accounts report looking at second jobs. You yourself have worked almost 500 hours in this Parliament, earning £100,000, all within the rules, of course. But how do you think that plays with the public, very briefly?
I focus on my constituents. I focus on chairing my select committee, and I always have. And I think you should be very careful about smearing MPs and making out that MPs are not focusing on their jobs. 99.9% of MPs I've met in Westminster are focused on doing their job and doing the right thing. Be very careful
We're
before
out
you
of
run our
time.
profession into the ground. I bet you are.
OK. Steve Brine, thanks very much indeed. Thank you.